saying so knowing that we've got adequate space to be able to accommodate those who need to be accommodated. And of course, we also want to encourage people who have got other conditions, diabetes, blood pressures, or hypertension, cancers, and other ailments. They must continue to use our hospitals. When we say that we want to give attention to COVID-19, we're not saying that we're not treating other diseases. They're just as important as any other. So it's important for people to know that we want to avoid anything that would cause morbidity or even loss of life, and therefore hospitals are meant for that. So it must not ever sound like we're saying only COVID-19 is what we treat. We're treating everything, and we'd like people to continue to use our hospitals. They must not fear to visit our hospitals because of COVID-19. We've also made sure that the approach to the hospitals for anybody, there must be what we call a separation point, which is a triage area. This is where we basically check the symptoms of anyone walking in and make sure that those who have got symptoms that are suggestive of COVID-19 should be separated and be tested, and those who don't have symptoms must actually move to other areas. We try and keep the hospitals streams that separate so that we actually avoid the mixing of patients. That's partly why we are not seeing a very huge mortality. We learned this from China, that the first wave of infection that happened in Wuhan caused a lot of deaths, mainly because of the mixing. But once they taught us that we need to watch out for the mixing of the patients, and it became important for us to adopt that for every hospital. So that is now a practice that we are utilizing. So once again, I want to reiterate that we did say that we wanted to defer the surge, the peak, so that we can prepare our health facilities, and this has happened. You will all notice that we are actually not at this point overloaded or overcrowded. We're managing the patients, and we can take more patients even if the surge increases. And we have actually stuck to all the commitments that we had made in terms of where we're going to put hospital beds, where we're going to refurbish hospitals. We are all on course and on track, and partly that's why one has to come around and inspect these particular areas. Some of the areas you get a little bit of excitement. I was looking at the tweets by the Honorable Kwahube, who made a story that she went to look for a hospital and she didn't find it, and that she was told that there was going to be a hospital in Rustenburg. And of course, I looked at the question and the answer. The answer she was given, which we submitted to Parliament, was saying that there must have a hospital with 200 beds in Rustenburg, and I can confirm that such a hospital is in operation. It was opened by Premier Job Mkhoro, and it's already operational. It's a private-public arrangement, and that's all that was in the answer. Now, now that there's a whole speculation, the hospital is not there. There's a photo taken. So I was having a chat with her as I was coming over. Clearly she misunderstood things, and the reality is that she went to look for a hospital on a matter that I never raised in my answer. And I was explaining to her that when we ask questions, we respond very seriously in Parliament, because a wrong answer is misleading Parliament. So we take them very seriously. We've checked, I've spoken to the MEC. All of this basically means that the answer remains correct. There are many other plans of other hospitals that we're planning, so many other beds in other places. We didn't talk all about that. And I was explaining again to Honorable Kwahube that the other plans were not part of the response that she was talking about. And so she needs to correct that. So I expect her to actually acknowledge and correct that in public, because it's a wrong impression that's been created. However, between myself and her, I have understood that she really misunderstood it. It sounds like quite a very honest mistake, because in this case, She went to a site, but nobody had spoken about the site, and then she spoke to people there, and then she thought that, well, there was something that should have happened, which it didn't happen, and she has now been able to realize it. And so I'm hoping that she's going to correct it so that the public does not remain with an impression that we misled Parliament, because we didn't. But the point I'm making, though, is that we've tried to honor as much of the obligations that we have put out in public. We've also made sure that we prepare the country to face up to the surge, and I can tell now that every country has had its own challenges, and so we wouldn't have expected that South Africans would not face similar challenges. But at this point, I think we have been able to use to use the period on the lockdown to prepare the services. Yes, there are pre-existing challenges in the hospitals, so you'll find that the hospitals, before there were reports of people who were lying on the floor, there were people who were having bad food, there are people who had a terrible attitude from staff and so on. We're working on that. We're working on all of these issues because they are part of what we need to correct to improve the quality of healthcare. We did indicate last year that the main focus for us is a quality improvement program, which means that we have to increase the numbers of staff. We have also to train the staff members so that their quality of care is improved, but also we have to refurbish our facilities, and that we've also got to look at certain things, the softer side of issues, kind attitude, a smile, a comforting word from the nurse, and so on. And so we still expect that during the times of COVID, and we expect that even though we know that our staff are working under pressure, that we still appreciate the work that they are doing. And so in this case, we'll still continue to call upon our staff to continue doing the work that they are doing, and also to say to them, they must speak out. When there are conditions which are unsatisfactory, they must speak out, they must inform us. Where there's inadequate protection, they must speak out, and we've always keep saying that like soldiers in a battle, soldiers need to go to a battle well trained, well prepared, well protected, ready to face the adversaries. In this case, I've still not come across health workers who say they are fearful of COVID, but when they sit together, they do indicate where they've got shortages, where they've got challenges and concerns, and we must address those. And so we have also sent a message to our administration that where management is shown to be lax, we'll take strong action, and that's why we have George Mukari sent a team led by Professor Zweli Mkhize to go and investigate. We're going to be sending others to other places. In fact, we're going to be sending another team to go to Pelonomi to go and look at what we received as reports. Some of the reports come to us as anonymous whistleblower reports. Some of us come from union members. Some of them come from staff and community. We pick those up, and we therefore try and act. I think we must say that at this point, we're still expecting that we will have another 2 to 3 weeks of a very high level of positive cases, and but we are really looking beyond that point. We are saying the fact that we are seeing the numbers decreasing, it should not be taken for granted. We must emphasize on the need for containment measures, distancing, use of masks, hand washing, sanitizers, cough etiquettes, and all of these become very, very important as a new way of how we're going to survive as South Africans. A possibility of getting the numbers to go down to much lower level can only happen if more South Africans and all South Africans do exactly the same thing, and therefore we can then reduce the need, the risk of the viral infection spreading. That's a very, very important message, because if we don't, there is a huge risk that when we open up more activities, more economic activities, which we must because the country has to begin to adjust to building its economy, growing properly, and at the same time making sure that we are ultimately able to get jobs and food security for everybody. But But when that happens, we're likely to get the numbers going up again, and that might be worse than what we've seen now. It's important for South Africans to actually appreciate that. And so we do need to make a call. We're going to be making this call again to local leaders, community leaders, traditional leaders, and church leaders. Let's limit funerals to 50. Let's reduce large meetings. Let's avoid having big bashes and parties. Let's avoid having situations where people are milling together and therefore, unable to ensure that there are containment measures. All of this becomes important because the battle, the COVID-19 battle, will not be defeated only in the hospital bed. It will be also defeated in the community out there by each and every South African who will participate in the containment measures, making sure that they wash their hands, they use the mask, they make sure when we use the mask properly. A few people walk around with the mask on their chins, on their necks, and some of them in their pockets. That is not right. What we need is the mask must be on the person's, on the, cover the nose and cover the mouth. And when I think those who are at home, you need to use whatever you can to boost your immunity. Use of vitamins, very, very important. And also making sure people are staying physically fit and, avoid getting exposed to flus. But diabetes, we must keep it under control. Blood pressure must be kept under control. People who have got HIV treatment, they must take their medication. People who are on TB treatment, they must take their medication and continue to do the test. We would like mothers to bring their children to the hospital to be checked properly, and they must be immunized. The mothers who are pregnant must come and check their pregnancies properly. So everybody needs to be looking after themselves because if we do so, we're then able to even defeat the COVID-19. We're going to have to learn to live with COVID-19. As long as we don't have the vaccine, we're going to have to learn to use these new ways of dealing with COVID-19. Thank you very much, and thanks for your interest. And if you've got questions, we can take a few, and then thank you very much. Okay, I'll take the questions. I'll do this afterwards.
Okay. Thanks, colleagues. We're going to introduce ourselves and direct the question to Minister or to MEC. We'll take one round. One round. 1, 2, 3, 4.
Good afternoon, Minister. J.B. Paulser from the SABC. Just a question with regards to the process of people who are waiting for the results but who have succumbed to COVID-19 and died at home. Just take us through that process, Minister, for those who aren't sure if they've lost a loved one at home, and what do they do with the body?
Well, we have asked that the Director General must send a circular to the funeral parlors, because the funeral parlors, no person is supposed to be buried without a death certificate, and no death certificate should be issued unless signed by the doctor who confirms it. And we're asking those doctors to assist us to participate at that level. So they should discuss the issue between the funeral parlor and the attending doctor who signs the death certificate. We're going to be issuing circulars to guide them so that we can have a seamless approach at that level, because it's a new issue. It's already been done in a few other provinces, but it's a new issue. We would need to make sure that there's an understanding. We want to do it for two reasons. One, we would like that such tests should be done and returned fairly quickly so that people know how to manage their situation. But more than that, we're worrying about those remaining behind. They must be tested. I just got a report just now, a request, somebody who's lost an aunt and just said, look, all my relatives are sitting together. Now we've just got the results confirmed. Now what do? Now we send that information around. We also issued out a number, what we call COVID Connect. So as soon as people got their test done, they can put their names and make an inquiry in that number. And we're going to push that there must be a short turnaround time. Turnaround time of about 48 hours is important for us, so that by the time there's a need for the body to be buried, there are results. But I think it's also important to say, if anybody has died and you're not sure, then I think you must take all the precautions. In any case, the problem with death during these days is not so much whether the person who is COVID positive or died of COVID-19 is going to cause you an infection. The problem is how do we behave, those all of us who are not seemingly sick, because we might be having an infection and still spreading it around, and we're not able to share that. So when we hug each other and we cry and we're holding each other and we're crowded in a small place and so on, we're coughing and sneezing, all those things are what really contributes. And so the restrictions on funerals, we know it's very difficult. This is Africa. Everybody's very sensitive about how you deal with those who have departed. We know it's a very sad one. Particularly imagine that we might not have been able to see the person in the hospital because of the restrictions. But we can't do otherwise. We have to really try and save as many people from infection. Should I chair now?
I think you're the second one.
Well, I'll take it.
Yeah, you can go.
I think this is a question more for MEC. Once the pandemic is over, and we hope it will be soon, will hospitals like the Niemeyer Memorial Hospital in Utrecht return back into general hospitals, since they are one of the main areas for primary healthcare in the region?
Yes, thank you for that question. It's a very good question. It gives us an opportunity to explain ourselves. Certainly, we have a few hospitals that around November, December last year, we were not utilizing fully. I mean, the bed capacity at some point was about 30% utilization. And around November, we submitted as a province a request to the Provincial Executive Council that we be allowed to repurpose those facilities. So we're in the process of restructuring. Now, when COVID came, it then redirected us a little bit. But a hospital, in fact, our plan initially was to convert Niemeyer Hospital into a CHC so that we are able to utilize the facilities that are this side because they are bigger. But now with the investment that is there, including the issue of ICU equipment and everything that has been put in, it will continue to operate as a district hospital once we are done with COVID-19. However, with our discussion with the head of department and his management, we might have to look at the specialties that we actually put in that facility, but it will go back. Yesterday we went to Richmond Hospital, which used to be a TP hospital. It's now going to run as a district hospital, and even there we'll discuss on the nature of specialties that we are going to put there. So yes, the facilities that we have repurposed, particularly those that we've brought back that had not been functioning for a while, will continue to operate as proper hospitals.
Esther?
Thank you.
Hi, I'm Esther from the Northern Natal News. I'd like to find out if you are able to quantify the rate of recurring infection in South Africa and how this contributes to the death. And also in terms of the rate of recurring infection, people who are infected for a second time. And also in terms of healthcare workers who are tested for COVID-19, while they are awaiting their test results, they are still at work, and by the time they realize they are positive, their isolation period is over. So during that time in which they were positive for COVID-19, they are still at work instead of self-isolating. And I'd like to find out your thoughts on that.
Okay, thank you. The reinfection is a rather rare occurrence. We've heard of it when people report. We had one person in Durban who raised it. Someone else I saw in a newspaper raised it. So there are few of them that have been reported. We've also heard that, I think we first heard of it in Korea, that people had been reinfected. We have actually asked that they must be monitored so that you can look at the rate at which it's happening. And also we will need some research, not just South African, but worldwide lessons to find out what would have happened. So already people have thrown out a number of suggestions as to why this might be the case, but it's all speculative at the moment. So for example, some people wonder whether there's a level of severity that might be mild enough that might make people to be susceptible to a second reinfection. Others are querying the duration of the availability of the antibodies. I've seen in one paper we're talking about 35 days. But I think that it's a very interesting area which we don't have much information about. So I can only say, let's just focus on people getting infected. That at the moment many of them tend not to be reinfected, but this number that get reinfected is still low, But even then, as it happens, does not require us to do anything new, unlike what we would have done before. The future research will be able to help us with that. The second issue you are raising about staff members who might have been tested, generally our approach is that you get tested for two reasons. The first reason is that you are a contact, you've been in contact with someone that was tested positive. The second one is that you have symptoms that makes us suspect that you could be infected. Now, in either of the two cases, you then get tested. And now let's assume that you are a contact and you had no symptoms. Then we take it that the average onset of the infection post-exposure tends to be about 5-6 days. So we have actually a recommendation from Ministerial Advisory Committee that we could actually test someone at day 5, after 5 days. And therefore, if that one is negative and not developed symptoms, it may most likely mean that that person may not actually have been infected. Then we've got a situation where people have got symptoms and they've now been supposed to be tested. And so those are supposed to be either they're positive or they have got symptoms or both, in which case you need to keep them for that period of 10 days isolation, which is standard for everyone. So we would want to work closely with our management just to see that there are no individuals who are forced back to work when they must still be harboring a risk of infecting other people, particularly the patients. It's an area that we have to watch very closely. And so it's an issue that we have to deal with on a case-by-case basis whenever it arises. And if there are people who have raised it, we just refer that to their management to make sure they follow the proper protocols.
Last question, Landile.
Thank you, Landile from Times Live. My question is in terms of the numbers in this area. So how many cases do we have? And then in terms of capacity, how many COVID-19 beds are there? And then just in terms of the department's response to COVID-19 in rural areas, is it different to maybe as opposed to urban areas?
I'll answer the last question. The first one, the MEC would love to give you those answers, and the HOD. They give us stats every day, and they are broken down per district. And I leave MEC, because what we normally want is that they, at a provincial level, they must try and give as much information. At a district level, they must do exactly the same. We've got the district mayor here, who is also a medical doctor. They should also deal with that kind of information if they wish to. So there is no different approach. All that is important is to share the information and is to reach out to the many layers of leadership. In this case, I want to thank the Nkosi Mdunge and all the traditional leaders who are here for the support that they've given us. In rural areas, people don't, they tend to use meetings to convey information, to discuss local issues and so on. We've actually asked them to reduce those and make sure that we don't have them, and they've actually complied. We've also said that they need to monitor the funerals, and they've also complied. We've also asked traditional leaders to help us to reduce some of the ceremonies which bring people together. They've also complied. We've also asked them to encourage people to wear masks and distancing. They've also been helpful at that. So the message is the same, whether in rural area or urban area, the conditions under which you contract COVID-19 are the same. All we need is to make sure that there mustn't be a sector of our society that's neglected simply because we're moving around only in urban areas. So we have decided to have this meeting mainly just to strengthen our support and working relationships so that we can approach issues the same way and solve their problems, and also continue to ensure that our communication between us, we're always available to answer in the event that they've got questions that arise in the process. At the end of it, in the traditional areas there, people won't wait for the minister. They want to know if Nkosi has got an answer, and therefore that's what we want to resolve. I think I'll leave the MEC and the province to deal with those numbers. I'll come back and then deal with this issue.
Okay. Thank you, Minister. Let me start by appreciating, Minister, the fact that we have Umeya Ungubane as part of the leadership of the district. It is very helpful to have him here. Sometimes some of the issues he deals with directly before they even get to the level of the province, because he's got the experience. So we really appreciate the work that he's doing. In terms of the numbers of Amajuba district, we are just, as of today, just above 5,000.
And so we come out of that briefing with the Health Minister in KwaZulu Natal, speaking about the fact that people will have to learn how to live with COVID-19. He's been there for 2 days as KwaZulu Natal is expecting a peak, inspecting hospitals and speaking to different stakeholders.
In the list, or in the province of the highest infected districts, for the first one is eThekwini, followed by Umgungundlovu, followed by King Cetshwayo. Then Amajuba is now the fourth. 7 days ago, Amajuba was the sixth in line. So it's moving quickly and very much higher in the ladder. In terms of the number of beds that we have in the district within our own facilities, which is the 2 hospitals, we've got and Niemeyer, when it's concluded, we will have about 500 beds in total. Once we've concluded these 2 facilities, this one and in Niemeyer. But we also have beds that we call our beds on call. This is where we identified outside stakeholders and we are paying for the beds, don't necessarily have to build. And these are your hotels and BNBs and whatever facilities that we have. We have 2 in this particular district like that. And together they are giving us close to 230 beds. So those we will utilize as and when the need is. Right now we've started with the smaller one and it is being utilized fully on a daily basis. And as soon as we require more beds, then we will move to the bigger one. The bigger one has about 200 beds and we will be putting, they will demarcate, we've demarcated it. One side will be used for quarantine and the other side will be used for isolation for communities in particular. So far we do have enough sufficient beds in the districts. But what we've also decided to do as a province, and this is a decision we took much earlier on, is to add what we call temporary structures. Those are structures that you can put in a particular facility and move them after the pandemic is gone. In the province, we started with putting up 4 of such structures. 2 are in eThekwini Niemeyer Hospital, 1 is in King Cetshwayo, the other one is Elembe. But we've then concluded with that, and right now we are in the process of adding 4 other districts that we can see that the numbers are rising, and we think it's necessary for us to bring that temporary infrastructure. And Amajuba is one of those, is part of the 4 to be able to add. Now, when we add that temporary structure, the numbers of that are going to be available in the district are going to go above 1,000. But right now we are very much low in terms of bed utilization, which is what the minister was speaking to, requesting people to actually come up once they feel that they're not feeling well. Don't stay at home. Don't wait for 2 days to see how far your symptoms are going, because after about 3 days, we have now discovered there's a trend. You catch what you think is a cold on day 1, day 2. By the 3rd day, it has gone so far, you don't wake up the following day. But if you had been in a facility like ours, a hospital or any of our facilities, then people, our health workers would have been able to take care of you. So we do have enough capacity in this district. Thank you.
Mayor wants to say the last word.
Yes.
No, thank you very much, Minister. Thank you very much, Chair. And at the same time, thank you very much, Inkosi Semadungeni and Mtwana Moiseni, Siyabonga kakhulu, and the rest of our people and the speakers that are present with us. I think a lot has been said about Amajuba district, and I think it is important that as Amajuba district people, what are we saying about it? Which I think is very, very important, that we need to take note of the fact that there's a lot that has been discussed here, coming from the leadership present, from the persons of MEC and also the minister, and also Inkosi Semadungeni. And this is the exact intervention that implemented. I think we're going to see a lot of difference. Of course, I also sit as a chairperson, co-chairperson of the district command center. I just want to raise a few issues. What is being said about the funerals? What is being about the gatherings? What is being said also about the non-compliance to the regulations, it is really common to all of us. And immediately, really, we can be able to comply to that. I think we are likely to be able to get a much better approach and a much better result, which I really promise that we are going to really be able to be all out with this kind of information that has been gathered here. In our next, district command center meeting, I think we will definitely be discussing predominantly the issues that have been raised here. And I would like also to promise, people of Amajuba district that yes, if we can be able to comply, especially in terms of funerals, because, one other problem that we have, and I'm very glad because, Inkosi Madungen has really spoken ahead, and also it has been raised the support that we have also from Amakosi, especially because when the funerals that take place, in the rural areas predominantly, and also in the areas where they are in Ngonyama Trust area, that's where some of the funerals we cannot be able to identify them, and people the symptom that they present with, they are exactly the same as COVID-19 infection in deaths, and they are not noted because there is no kind of a communication with them. And I think really from this engagement of today, which I'm very, very grateful because it talks exactly to what we want to see happening. I think we will definitely, and I can see a lot of the people nodding their heads, people that were with at the district command, and I'm very, very convinced that we're going to be able to work that direction. But in terms of now managing, rural and urban, the district of Amajuba is both rural and urban, but predominantly rural. In terms of the rural part, we don't really preach a different gospel. We preach the same gospel, whether you are, in Newcastle or whether you are in Danhauser or the Madlangeni. We preach the same gospel, that of prevention. And I think really, from this, really, I'm very, very positive, and I'm smiling because I see the numbers going down based on the fact that, in 2 weeks' time, the minister has already mentioned that we will be having a very big scourge. We'll be seeing a big rise in KwaZulu Natal. But I want to say that, in Amajuba, definitely we will definitely be going all out, to fulfill the demands as they are required to. Thank you very much.
So, the minister is just going to wrap up for us in isiZulu.
Thank you.
Siyabonga kakhulu. Siyabonga kakhulu. Sicela ukuthi sibonge kakhulukazi kubo bonke abathatheli bezindaba ngokuthi basiphelezele nje basihamba sibuka isimo sokulunga kwesifundazwe saKwaZulu Natal. Basilindele ukuthi amanani alomkhuhlane we-COVID-19 azokwenyuka. Kakhulukazi nje basivakashele kulesifundazwe, sifuna ukuba nesiqiniseko sokuthi sihambele indawo ezihlukene, sihambele indawo esemadolobheni, sihambele indawo esemakhaya. Kungakho nje sizoba nomhlangano namakhosi. Amakhosi akhona lapha kakhulukazi aholwa uNkosi uMdunge ophethe ongusihlalo wendlu yamakhosi, nawo wonke amakhosi akuleso sigungu, umntwana waseNdlunkulu, umntwana omboniso, namakhosi endawo. Kubalulekile kakhulu namhlanje ukuthi uma sizokhuluma lolu daba sicacise ukuthi ngendlela lesifo esiqhubeka ngayo sifanele ukuthi sonke sisithathe njengesifo ekufanele sibhekane naso, silwisane naso. Kakhulu nje kulula ukuthi sithathelane, kodwa futhi kulula ukusivikela. Kanti uma ngabe siphunyukile sangalapheka siyahlupha ngoba siba nayo imiphefumulo esilula nayo. Kodwa uma sibheka isimo esiqale sikuso ngesikhathi siqala ukubika ngalesi sifo, sasitheke sifisa ukuthi lokuvalwa kwe-lockdown kusilekelela ukuthi kube nendlela yokuthi silungise imibhede, izibhedlela, amawodi abahlengikazi, odokotela babe khona ngobuningi babo. Njengamanje-ke siyasho ukuthi sesizamile futhi akukabi khona isibhedlela la sizothi sekuphele yonke indawo yokulalisa abantu imbhede igcwele kodwa into ekhona ukuthi imbhede ikhona sisafisa ukuthi abantu bazi ukuthi silindele ukuthi number ngenzeka zenyuke ngakho abantu bazokwazi ukuthi balaliswe esibhedlela. Kubalulekile kakhulu ukuthini ukuthi umuntu onalomkhuhlane angawuthathi kancane, angathi hayi umkhuhlane nje uzodlula, kakhulukazi kwasebekhulile nalabo ababuthakathaka ngezifo ezithile zoshukela no high yoma blood pressure nezifo enjalo zo cancer, bangahlali kakhulu emakhaya baqinisele nomkhuhlane, kodwa sifisa ukuthi mabasukume basheshe bavele esibhedlela ukuze bezothola ukulapheka. Uma ngabe usheshe wathola ukulapheka umuntu uyakwazi ukuthi akwazi ukusinda asheshe aphume esibhedlela. Okubalekile futhi ukuthi lesifo sinempawu eziningi ezifana nomkhuhlane ojwayeleke kakhulu ngesikhathi sasebusika, ukuthi umuntu abe nokuthi mhlawumbe uyanhlinhliza emakhaleni athimule noma kube khona ukoma komphimbo noma umphimbo ubuhlungu noma khwehlele. Kwesikhathi agcine ekhwehlele ukuthi noma ngabe ushiya igama elilodwa uyakhwehlela, ushiya igama elilodwa uyakhwehlela. Kwesikhathi agcina nesifuba ahluleke ukuphefumula. Kube kude nje ukusukuma nje esihlalweni uyophuma ngomnyango. Konke lokho kuyizimpawu ezikhombisa ukuthi lesifo sisuke sesimxakile. Omunye aphelelwa amandla, omunye kushisa umzimba kakhulu, omunye kube umzimba obuhlungu, amalungu omzimba bebuhlungu, izicubu zonke zibebuhlungu. Zonke lezi zinto siyafuna nizinake bese nisondela ngasesibhedlela ngoba sithola ukuthi manje kunabantu othola ukuthi ubana akasekho. Uma uthi uyabuza kube nomkhuhlanyana usuku olulodwa izinsuku ezimbili, singalindi-ke zize zibe ningi iy'nsuku. Kuthi nje uma ubuza ukuthi umkhuhlane uxakile usondela ngoba siyakwazi ukulihlolela legciwane sibone ukuthi kwenze kanjani. Ngokuhamba-ke kuwo wonke ama-province siyabona ukuthi awahambi ngokufana amazinga alesifo. Siqale saqina kakhulu endaweni yase-Western Cape, sesithanda ukwehla kodwa sikapheli. Nakhona sabatshela ukuthi abagade kakhulu, sathi ukwenyuka e-Eastern Cape siyehla kancane khona kodwa sikapheli futhi. Sanyuka kakhulu-ke sadlondlobala ngasendaweni yase-Gauteng. Lapho-ke Gauteng isephezulu noma sibona thina esibalayo ukuthi siyangokwehla kancane. Kodwa-ke indawo esiqubuke kakhulu KwaZulu Natal iphuzile ukungena yona kulo mkhakha, yenziwe ukuthi saba nesikhathi esiningi sokuthi ingxaki ezazisekuqaleni sisuka lesifo sakwazi ukuthi sizibambe singaqhubeki kakhulu. Kwathi-ke uma kuba khona i-lockdown sangaqhubeka lesifo kakhulu, kwathi noma kunezibhedlela kwakubona ukuthi siqubuke kakhulu zavalwa zalungiswa zaklinwa, kwase kuthi ukwehla nabantu abebekade benale mkhuhlane base balandelwa nasemakhaya bacela ukuthi bahlale phansi sathi ukwehla. Kodwa nje basivulile nje sithi akuvuleke izinto zonke zomnotho abantu babuyele emsebenzini sivele sanyuka kakhulu. Besilindeleke ukuthi sokwenyuka kakhulu. Ngakho-ke sasilindele ukuthi nizothi masenyuka abantu bebe sebefundile ukuthi sekufakwa ama-mask manje, kwenziwa ama-sanitizer, kugezwe izandla, kuyaqaqwa umuntu uma emile ngiqaqane. Konke lokho izinto esizifunde kulezi nyangana nje esibonayo ukuthi abantu abaningi abazenzayo ibona basenza ukuthi kube lula sibone lesifo ngathi sithanda ukuthamba singathi siyehla. Kodwa akusho ukuthi sesifike ekugcineni, asikafiki. Futhi uma ngabe singase siyekelele njengoba sobuye sifune ukuvula ezinye indawo, kuvulwe nemigwaqo, kuvulwe amabhanoyi, kuvulwe namafilimu amaningi avaliwe, kuvulwe amahhotela, izobuye futhi lesifo sinyuke kakhulu. Sesaba-ke ukuthi sokwenyuka kakhulu ngaphezu kwaloko besikubona. Uma sike sasidlondlobala sosihlupha kakhulu. Ngakho-ke sicela ukuthi wonke umphakathi uqinisekise ukuthi imiyalelo esiyibekile ayilandelwe. Kakhulukazi sicela ukuthi emakhaya ayingabi khona imigidi, ayingabi khona imingcwabo emikhulu, zonke indawo amaphathi awami kubantu abasha, indaba zamabheshi azime, kwenzela ukuthi sizonciphisa inkinga yokuthi abantu bathelelwe isifo ngendlela engafanele. Sasikhulumile nasemabandleni sathi noma ngavulwa kodwa mayizoba abantu abawu-50 kungcono lokho kuyanceda ngoba kusho ukuthi ngesikhathi abantu bedumisa bese behlabelela benza yonke into, kulula ukuthi onesifo athelela abantu abaningi endaweni eyodwa. Sikubonile endaweni eningi lokho kwenzeka. Basincedile ukuthi bake bathi ukubamba bathi gozololo kuyo yonke lezi nyanga sangaqhubeka lesifo. Kodwa la sovula khona sizodlondlobala lesifo siphezulu kakhulu. Uma ngathi ngilinganisa-ke ngokwezibalo ngicabanga ukuthi uyoshaya isonto elizayo lothi ligamanxa KwaZulu Natal yobe inamanani asedlula lawa awase-Western Cape. Ngakho-ke kufanele sazi ukuthi kukuthini ukuthi siyasibamba lesi sifo, siyakwazi ukugobeka. Besihambile-ke sivakashele zonke lezi ndawo, savakashela-ke endaweni esemadolobheni eMgungundlovu naseThekwini siyobheka ukuthi ezibhedlela okuthiwa ziyakhiwa zihamba ngendlela eyiyona yini. Nokho-ke siyathola ukuthi hhayi zihamba ngendlela eyiyona. Njengoba silapha nje besilapha endaweni eseMadlangeni, lapha endaweni yaseMadadeni siyobuka nakhona ibhedlela zihamba ngendlela eyiyona azikagcwali kodwa futhi siyafisa ukuthi abantu bazi ukuthi silindele ukuthi inamba sazokwenyuka ngakho-ke nibokwazi ukuthi nilindele esibhedlela ukuthi nisheshe nilapheke nibuyele emakhaya. Nakwezinye indawo-ke kukhona lade besola khona ukuthi kwathiwa ibhedlela zikhona kodwa ibhedlela zikho. Ngibone nje umbhalo obubhalwe omunye umhlonishwa uGwahube we-DA ethi kwathenjiswa ibhedlela. Kodwa ngithe base ngiyabukisisa ngabona ukuthi kusho ukuthi akawuqondanga kahle impendulo ukuthi ibhaleke kanjani ngoba mase ngimchazela ukuthi sibe nesibhedlela esisodwa Rustenburg esakhiwe esinembhede u200 kwacaca ukuthi ngempela kwangekho esinye sasisifakile kulolo daba. Kusho ukuthi-ke ukuqondisa nje inkulumo ngoba baningi abajaha ukuthi ingani kwathiwa kuzoba khona ukuthi kuphi. Iy'nkinga zikhona emnyangweni wezempilo uma ungabheka sihlale vele siney'ngxaki kushoda ama-ambulensi nezibhedlela kwenye indawo zakhekile kahle, kwezinye indawo kushoda abahlengikazi, kwenye indawo abanye bayahluthuka bangabaphathi kahle abantu. Zonke lezo zinto siyazibona, siyazilungisa, solokhu siziqhuba sizilungisa. Kodwa okukhulu kwamanje sithathe nje isikhathi lesi sale ngxaki yale sifo ukuthi indawo ezinezibhedlela bezinganakekile sizama ukuzilungisa masishane. Kwenye indawo noma kade kungasesona indawo esibhedlela ukuthi kulala abantu njengalapha nje kunenesizome sesiphendulile sifaka imibhede kunabantu bezongena balaliswe. Kwenye indawo sivele sakha nje isibhedlela esakhiwe phansi sakhiwa ngamaphaneli bese sizosibheka eClaywood. Amanye amazwi uma ngabe le mibhede igcwala ikhona indlela yokuthi ngakwazi ukuvula ezinye ibhedlela noma eminye imibhede yokuvala iy'khala zokuthi abantu bangaxakeki kuze kube ukuthi abantu bahluleke ukulashwa esibhedlela. Ngakho-ke socela nje ukuthi sibambisane kakhulu. Okokuqala nje kukho konke lapho nibona khona kuney'ngxaki emnyangweni wezempilo sitsheleni sokusukumela sikulungise ngoba akukho soka lingenasici. Okwesibili sithi uma ngabe umuntu enomkhuhlane ungawuyeki uze hamba isikhathi eside, sheshe uvele uyolashwa ukuze uzosheshe unqobeke ngoba sifake i-oxygen lapha, sifake le mithi emisha ekuthiwa dexamethasone. Sebebaningi abantu abaphuma ngisho ku-ICU babe ngcono into ebingenzeki ngaphambili. So konke lokho sithi akube nethemba lokuthi kuningi esizokwazi ukwenza ukulekelela ukuthi impilo zabantu ziphephe. Phezu kwalokho-ke sifisa ukuthi umphakathi wonke awubambisane nathi. Abantu abasincedayo ukuthi kuze kuba ngathi inamba ziyabambeka ziyehla yilaba sebeqala ukufaka amamaski, bageze izandla, bafaka ama-sanitizer, bagqagqane, benze konke lokho. Ibona benza ukuthi iy'namba zethu kwehla. Kodwa bazokwenza ukuthi zibuye emuva, ziphinde emuva yilaba abangakwenzi ngoba manje kuzotholakala sekunendawo evundile yokuthi le sifo sibuye siqale phansi futhi kabusha. Ngakho-ke kufanele sazi ukuthi manje masikhuluma ngale sifo asakhulumi ngesifo esikhuluma ngaso saseShayina, saseMelika, sase-Italiyane, sase-Engilandi. Isifo sesithatha omakhelwane, sithatha ihlobo, sithatha abangani, sithatha umndeni, sithatha yonke into, abantu abalapha eduze. Manje sithi singasivikela ngoba kulula ukuthi lesifo simngenele umuntu kodwa futhi kulula ukuthi sisivikele kanti siyalapheka. Ngakho masingabambisana nje siyokwazi ukuthi lesifo sisinqobe. Ngiyabonga.
We will now proceed to our next engagement. Thank you.
Kodwa sengaze ningimise kabuhlungu kanjena bafethu.
Hayibo, engathi le
oh, hayi isipho sakho i-coronavirus umnikelo wami i-coronavirus le umnikelo wami engithi anginikele nami emhlabeni. Ngiyabonga Minister kakhulu. Ngiyabonga.
Yes, I'm going to just raise that for the editors. I didn't know that they were using
Yesterday, where's my I'm gonna phone them. I sent you guys. Yeah, keep.
Nice.
I was so upset last night. Because I know you. By the way, this morning.